Good morning, my name is Christy. Today I'm going to be performing a Foley catheter insertion, and I have checked the doctor's orders to make sure that I have the correct catheter, and I have all my supplies gathered. I have verified the patient by name, and I've also verified his wristband, his date of birth, and I've introduced myself. And before I perform the catheter insertion, I am going to perform pericare on the patient. My gloves have ripped, so I am going to get a new pair of gloves. But for the performance, for the video, I'm just going to continue with my procedure, and I would get a new pair of gloves. I won't be needing this. I'm going to be performing a female catheter insertion today, so I can just set this to the side. And then I'm going to open up my betadine swabs. Also be performing my lube. I'll be opening that.
Who's that?
My specimen cup to the side. I am going to check my catheter. I'm going to insert some saline into it so that I can make sure that I get a balloon. Okay, and I got a good balloon, so I'm going to leave that in there. Making sure I have a good grasp on it so that I don't contaminate it. And I can just set that on my lube, get get that ready. Before I do that, I'm going to get one of my swabs, and I'm going to start by going from front to back. I'm going to, with my non-dominant hand, spread the labia, and then I am going to go over like this, making sure after I swab I go around to the corners, and then I would throw it away, and then I do the other side, going around, and then the last one down the center, front to back, to the side, making sure that I have enough lube, 3 to 4 inches. I would insert the cath. While I'm doing this, making sure I go in 3 to 4 inches. Once I start seeing some urine come out, I'm going to go ahead and go in another inch. Once that's in, I can let go of the labia, making sure I got about an inch after that, so we can make sure that it is inserted correctly. Then I am going to get my saline, and I'm going to insert about 5 ml. Once I've inserted that, I'm looking at the patient, make sure they don't have any facial grimace, and ask if there's any pain or discomfort. If they say that there is, I'm going to go in about another inch, because that means I'm not in the bladder. And once I've done that, then I can just go ahead and remove the saline. Throw that in the garbage. Then at this point I can take off my sterile gloves. Now I get some new gloves. Making sure I cover the patient, try to make them as comfortable as possible. With the gloves again. At this point I can just throw this out. Make sure all this goes into the garbage. I would get the cath and place it in at the Y point, just to make it accessible, not so stiff for the patient, so he can move his leg. Make sure that that's clamped on there there we go. And then I'm making sure that the bag's not clamped. I would secure it to the side where it's non-movable onto the side of the bed. Cover the patient up. Make sure they're comfortable. And lift up their bed round. And before I leave, I would also perform peri-care for the patient after I've inserted the catheter, just to make them feel a little bit more comfortable.